All right, so what is the exchange? We throw around this term, a lot of people are like, all right, what are we talking about? It's an organized online marketplace for insurance. I love the analogy. It is like Travelocity or Expedia for health insurance. It's this idea that we as consumers could go to one place, enter in a little bit of information, and get competing deals from multiple different private companies. The idea being that when you give the consumer more choice and control, that through the free market system will lower the cost of the service or the product itself. Well, so the insurance exchange is actually going to be an online portal. It will be organized online like that. But there are also a lot of things that it does behind the scenes. It also serves a regulatory function. Keep in mind, we've got about 350,000 people who are going to be getting their insurance. They're a private insurance company through the exchange. Well, that's a lot of market share. That's a pretty big proportion of people in this state who are going to be buying insurance. So basically, the concept of the exchange is this: that if you're an insurance company and you want to sell to this captive audience of 350,000 people who are now going to be shopping in this marketplace, you're going to have to play by a certain set of rules. Those rules say that you can't deny people because of pre-existing medical conditions. It says that you can't charge people more because of their health status. Some of these things we've already said. Well, the exchange is a regulatory function. If a plan is not playing by those rules, the exchange can kick them out and say you can no longer sell in this marketplace. So there's an additional added element to it where it's not just that the marketplace itself is organized and those free market principles are at play, but that there is a regulatory function where it says, you know what? You got to play by the rules that are fair to the patients and fair to the consumers that are buying your product. There will be an existing marketplace. There will still be insurance sold outside of the exchange. That's a question I get a lot. Keep in mind there are a couple of folks who are not eligible to get insurance through the exchange. Illegal immigrants are one element. There has got to be another opportunity for folks to be able to purchase health insurance, so there will still be plans sold outside of the exchange. But the idea is that if you create a marketplace where you bring in all these consumers and you level the playing field, that those market forces are going to drive down premiums. All right, I mean, this is the basic concept. One of my favorite things, and I found this out not too long ago, this concept of the health insurance exchange actually came out of the Heritage Foundation. Does anyone know the Heritage Foundation? It is a politically conservative think tank. And they come up with a lot of policy recommendations. This was a concept that came out of that. It's basically this idea of harnessing free market principles to drive down the cost of something by creating the framework for it. That's the whole point of the exchange. It was actually added into this as a compromise element. Politicians now, some will take their hands off, some will claim it who shouldn't rightly be able to. That's the nature of politics, but I think it's very interesting to share that with folks. That's how it was added. It's this idea that more consumer choice will actually. The other thing I want to mention this as well too. Something else that happens behind the scenes with an exchange is that right now, if I'm a small business owner, if I'm Mark Jacobs, I have 35 employees. We are one risk pool. So we buy insurance. There are 35 of us all in the same boat. If one of those employees gets sick, all of our premiums go up, right? If I am a risk pool of 6 people, I'm an even smaller employer, and one of those employees gets sick, what's the difference there? How high are my premiums going to go when I have 6 people? Even higher. You start thinking about the proportion of what happens when one of your employees in that risk pool gets sick. Well, the concept behind the exchange is that, so there are going to be multiple plans offered. There's an Aetna plan, okay? Multiple small businesses buy into that Aetna plan, and maybe there are 20,000 people who buy that same plan. The risk is shared among all those 20,000 people. All of a sudden, it's a mechanism to pool the risk even further so that it also helps distribute that. When I say risk, what I mean is the financial risk. But it's a way to actually distribute that more so that you're less vulnerable to those really high spikes in premium costs because of an illness or injury or something that happened in your risk pool. And I'll tell you, small businesses in Tennessee have been wanting to do this for a very long time. Pooling their risk and purchasing power. That's the other thing. You know, I talked about the 350,000 people. That's a captive audience, and that's pretty big purchasing power. If you're talking about 10 plans in there with 35,000 people in each plan, that's pretty huge. There's negotiating power there. One of the reasons that small businesses pay 18% more than large companies is because they don't have the same purchasing power. It's like Walmart competing with True Value. That's why there is a price difference in the premiums themselves. So part of the idea behind the exchange is that it evens that playing field by letting the small employers and the individuals pool their purchasing power together. So who's eligible? Lawful residents, only citizens, people who are uninsured or buy individual health insurance, folks who are not already in a large employer-sponsored plan. If you work for a large employer that offers health insurance, you're not eligible to jump over and go into the exchange. Brad mentioned this, the free choice vouchers, those were eliminated. So it's only for people who otherwise wouldn't get affordable health insurance through their large employer. A couple more complicated factors in that.
Like 5 minutes behind. Uninsured or by individual health insurance.
Mm-hmm.
Why would they even want anything to do with the insurance exchange?
Because we talked a little bit about the sliding scale premium tax subsidies to help pay for insurance for people under 100% of poverty. Those are only eligible if you buy your plan through the exchange. Okay. So that's part of the reason that will draw people to that market. These are folks who are not eligible for TennCare or Medicare. So remember, some people are going to come through, about 300,000 people are going to come through this portal who are ultimately eligible for TennCare, but once they are eligible for TennCare, they can't then choose to go into the exchange unless their income level raises. All right, also businesses, qualifying businesses, up to 100 workers. And this is actually, the state is actually going to make the final call on how large or small the businesses can be to buy in the exchange. That's one of the decisions the states will make. And also, small businesses are eligible for tax credits through the exchange. Brad mentioned as of last year, there are sliding scale tax credits available to small businesses to 35% of what they pay for health care for their employees. In 2014, it raises to 50% of their costs for 2 years.